So good evening, Tewksbury. It is Thursday, May 21st, 2020, and it is 6:05 p.m. I'd like to call this meeting of the Tewksbury Board of Health to order. We do have a post agenda tonight. We're going to rearrange the order, and we're going to have Ron Beauregard, who is our tobacco control agent, speak to us briefly, because there are other things that continue to go on, including the new tobacco regulation, which kicks into effect on June 1st. So we thought that it'd be good for Ron just to come before us tonight and talk about the upcoming tobacco regulation and what that means for us in town and for our regs. So Ron, I'll turn it over to you, and thank you for joining us tonight.
Very welcome. I appreciate this opportunity. What I'm going to do is provide you a quick background of what the regulations currently provide for, the new state regulations. They went into effect on December 11th of last year. And what we've been doing now on what to do, and Susan and I will be discussing this further, but I figured I'd let you know now. I've been trying not to meddle too much with the major topic at hand. But the policies in effect since December 11th is a very interesting one, and one that the board has worked with and raised several years ago, and that is the age at which the consumer needs to look before they need to be ID'd. And there's a very interesting that I've been very, very active on in regards to communicating with Boston, Mass Association of Health Boards, and that is, as I read 105 CMR 665, the provision involving IDing of customers, I have found majority agreement with among my colleagues that this new regulation, unless they changed it on Wednesday, because they made some changes on Wednesday, they parts to this new state law, Chapter 133 of the Acts of 2019. But the provision on IDing would say that the retailer is responsible for IDing all customers. That's the language. So this will be a very important to drive home. And I have an idea in regard to, we obviously each community will have to decide what language they like, and I will be forwarding language in the near future once I get a chance to be the newly amended regulation of 105 CMR 665. It's my understanding that the Public Health Commission voted on that yesterday, although I haven't had any official word as of today, and I haven't communicated yet with the folks there. Now, things are in effect. In a nutshell, if this holds true, ID all customers. Of course, as of June 1st, no selling of flavored tobacco products. And flavor means the taste or anything except for the taste or aroma of tobacco. The state law product as a vape, even if it contains no nicotine, as of yesterday. The state law is going to regard the product as a vape, even if it contains CBD, as opposed to nicotine or any other substance. In general, the state regard a product as a vape if it contains any substance. The only exception would be, of course, THC, which would be controlled by the Control Commission. Every store up until March 13th was the last time I did a physical inspection. We cannot have a store on the stores, at all of the stores, that they don't have a vaping product that contains more than 35 milligrams of nicotine per milliliter. This was a substantial regulatory change because it knocked out food products. They have 3% brand and a 5%, 3 and 5% nicotine. Both of those are off the shelves at all convenience stores. There's also, in relation to that 35 milligram limit, they need to have documentation for any vapes that they have in the store to confirm from the manufacturer that there are no more than 35 milligrams per milliliter, and this is important, and that express 1 milligrams per milliliter, as many manufacturers measure it in other ways. And again, I reiterated, sometimes it's restating the same thing different way, but June 1st means no more Newport cigarettes, no more menthol flavoring. It means no any flavored tobacco products, whether that be in the form of combustible product or a vape. Vape, of course, has been off the shelves. Flavored vape has been off the shelves since the governor's initial ban. Then I don't want to dig too much into the weeds, but a lot of the things that can get overlooked are not currently doing the inspections live. What I'm going to do is the health department provided me with the email addresses of all of the tobacco permits, and I'm working on building an email list for all of our roughly 350 retailers in the collaborative. And I'm going to begin priming them and making sure they understand what the regulations mean. I assume most of them do, but sometimes, and I'll just give you pretty well, give an example in regards to the vaping that may not have nicotine, and those are still regarded as vapes. But there's new smokeless tobacco that I see much on the shelves now. One brand called Zin and the other one Velo. They're a product that specifically advertises that it contains no tobacco. However, they contain nicotine. Under the definition, that makes them a tobacco product, regardless of what the advertising defines it as. So we need to make sure they understand that as well. So I've put together a cover letter. I'll be sending that to Susan soon. I want to send it until I had it filled. And then the last thing is that I'm pleased to let you know that the Tobacco Control Program has awarded our program a substantial funding for this fiscal year, but it will be rolled over into next fiscal year, and it is for the primary purpose of doing what I'm currently laying the groundwork to do. That is to educate strongly, so that when enforcement comes, we know we have a solid back. So I'm going to be working with all for their creativity and knowledge to help us put those new funds for the one-time side funds for this effort. The last thing I will say is that there is some language in your regulations that requires an owner understand all of the regulations and indicate that he will convey this to all of his employees. Now, in the past, I've been working with Tewksbury and the other communities. It's nothing I call them upon. In other words, they technically an affidavit in the store that says they've done this such thing, but I don't inspect. There are many things in regulations that they're there in the event that if you need them. This may be one of those cases where we need them, and so I've put basically called a statement of the applicant for a tobacco product sales permit, and it goes through what I've just mentioned to say I am the permit holder, and I understand that I can access the laws through this link. I understand you can reach myself or the health department, and then maybe a 15-point bullet that pretty much summarizes everything that I've just discussed. I understand this. That way there can be no confusing, but I didn't know the retail can't catch them. So this may be a very good way to get things rolling. Hope I didn't go too long, but I just wanted to give you a flavor, so to speak, of what we've been up to.
Well, Ron, I'm glad you shared with us that the regulation may have been tweaked this week, as that was news to me. And
yes, well, the reason why, Ray, is the regulations that went into effect on December 11th had nothing in them in regard to the June 1st hammer, if you will. There's nothing in those regulations whatsoever. The only way you can read the no flavor, no menthol for all the remainder of tobacco products is if you read Chapter 133 of the Acts of 2019. There's not one mention in the regs, and that's because of the quick nature that they wanted to put in effect. So they were done in phases. I'm anxious to see them, and I'm anxious to let Susan, of course, the board know what, if any, changes there are.
Yeah, because I just did a quick search in mass.gov and could not find any mention of anything that's changed. All that's posted publicly are the regulations that went into effect. So
Yeah.
I appreciate whatever you can find, you can send to us, which I know you will. And I do have a question, and unfortunately, it's not a hypothetical.
Okay.
Um,
It's not a hypothetical?
no, it's not a hypothetical question I'm about to pose to you. Under the business reopening plans, retail stores are being asked to, or those that weren't deemed essential that aren't allowing customers in, are able to open up according to the state's plan and allow for sort of drive up pickup of what you've purchased. We don't have that specifically called out in our tobacco regulations because honestly, that was nothing I ever thought might happen.
Well,
So
in a
I
way,
guess my question for you is, can one, under how our regs are written and in the state, is one able to purchase tobacco products from a tobacco retailer and never set foot in the store and have that product be purchased be walked out to the purchaser?
no, I don't have your regulations in front of me. I'll check them. 0.9% certain you cannot. There's a provision in there. We used to have a provision that said face to face. There'll be a provision that will cover that.
We're losing you.
You see me all right?
Oh, I just see your mouth now.
Oh, because
There we go. Oh, okay.
I can't see myself, so it's like a pretend mirror.
I'm not sure if I'm dismayed at this answer or if we need to consider taking action because we do have 3 places that probably think that they are going to be allowed to do this on Monday.
There's two different issues. One is the issue. Well, of course, I assume most stores are open. Gasoline combos and such.
Yes, they are.
So of course those are in person. So it's not affecting those businesses. Where it has affected businesses, about my touching, I suppose, of the essential business and understanding of it, and I did read through it earlier in another community, in a couple of other communities. Bottom line, as you know, the model for all of our local regulations was to really allow the adult-only tobacco stores to really have the cornucopia of flavors. They can't do it with vape because that overwhelmed, or I should say, overruled any local regulation. But in regard to combustibles, that was all. They were all in on that. That was what they were going to be able to do. So mango cigarillos, rape, and all of that sort of thing. The state changed the landscape severely for a vape shop after June 1st. As I understand it, unless someone can tell me something product that's different, the only thing a vape shop or a smoke shop will be able to sell differently in the tobacco world is a vape that has more than 35 milligrams of nicotine per milliliter. That's unflavored. So it's been a huge hit on them. So I've gotten requests from vape shops as to what to do. Many of I met with your owner of the vapor station, and that was a very sobering one-on-one thing I had with him for 10 or 15 minutes or so. But any vape shop, and this is wouldn't be only Tewksbury, it would be other communities as well. We've heard of this curbside, and it's not allowed. First, on your regulations, Susan, we could talk about this.
Well,
you want?
Yeah, but if there's action to be taken, it has to be taken tonight. I guess they should have been reaching out to us instead of trying to, shall I say, ignore the order and continue operating. It would have been better had they reached out to us.
But
So we have an issue that all three of them were operating, and I did contact all three. They've been told to close. I, for whatever reason, figured if you could order marijuana and get it on the side of the street, that we might be able to temporarily amend ours, but I obviously wasn't thinking straight. So
well, no.
this is going to be something we're going to have to deal with, because they are facing, this is a detriment. I mean, they're facing closure, I'm sure. I
Well,
don't know what, we may have to have the police go out there, because they will continue to sell, I think.
well, the other, but you can go. I mean, the way of going at it with tobacco control regulations is not probably as a firm step as the powers that the boards of health have in regard, and the health departments have with the essential enforcing closure of businesses that are not classified as essential. Now, look, the complaints I've received from vape shop owners, not in Tewksbury, but in other communities, is that the biggest one is the liquor store comparison. Okay,
We understand.
I think it's the word essential may perhaps be a misnomer. It's more what are allowed and what are not. What is practical?
Yes.
So in this case here, I do have some language that I can send to
Can't
you.
see your eyes anymore, Ron.
Oh, sorry.
Just thought you might want to know. Go ahead.
You all right?
Yep.
The other power you have, and Cheryl Sabara has been all over this one and is very knowledgeable. This goes into an area of law that I'm not particularly familiar with, but I know she is, and she has a cease and desist order that could serve.
Oh, I'm aware of the cease and desist order. Yeah.
So the cease and desist order would be the most effective method.
Well, the new changes in the before the cease and disorder was easy to do, and now we have this step where you notify verbally, then you do it in writing, then it's up to $300, up to $300, up to $300, and then you can go to court. Now you have to go to court to issue that cease and desist. So that's right in the rules. So I don't know. I mean, I guess that's what it's going to be, 5 days in a row, and then we're going to have to say we're going to court, which we don't have very much court option right now. So it's not, actually my option 2, depending what you say tonight, is I will contact Department of Labor and Industries, Labor Standards, DLS, and they will assist me on this if I need their help.
All right. Well, reach out to me if there's anything else you think I can give assistance.
Yeah, I'm just surprised they can't do, if you can do marijuana on the side. And we're trying to be business friendly. I'm surprised we can't consider. I don't know. What do you guys think? Should you be considering this?
I think what your question is the realm of why is, you could say, why is a liquor store an essential?
No, that's not my question.
No, I know that's not your question. I'm saying
Yeah.
realm, because we don't even get to your question on the curbside because they're not an essential business.
No, starting Monday is regular retail. Yeah. Curbside, regular retail starting Monday.
Oh, so this is a weighing then you're having of, it's a safer way, but it's also not the most efficient way of making sure that you're checking for age. Safer public health wise. But this is but the public health issue is no more of a important point than it is for somebody walking into a local convenience store and such. Why? I guess I'm questioning why would a vape shop be? The vape shop has a stricter standard. As a vape shop, they're a retail tobacco store under your regulations, and they have to ID anyone who even enters their store.
Right. And they would do that. They'd have someone call in. They know what they want. I want blank, and then they put the package together. They can pay for it over the phone, and then they check ID when they pick it up. That's what I was told. What they wanted to do.
Are you, just be sure I'm sure I understand what you're saying? You're not. Are you saying that that vape shops will be regarded or not be under the yoke of an essential business as of.
It changes as of the 25th. It doesn't matter if you're essential or not. You can do curbside pickup of anything, hats, shirts, whatever it is, batteries, whatever isn't batteries are essential. Sorry.
Marijuana is and medical marijuana is allowed at curbside.
They're going to do that. I haven't paid attention because we don't have that. But that was the essence. Although they did, yeah, I think so. But I don't know the answer to that. But they have been, because the medical was essential, wasn't it? So recreational might be curbside. I don't know. I don't know how they do it, to be honest.
I'm going to find out.
But our products are very specific. I mean, you go for a marijuana shop, there's usually I haven't been into ours, but I mean, any of near us, but there's usually a myriad of products that you have to pick from. It's a little different than a vial or a pack or a cigar with a name on it. I want blank number of cigars. It only helps people who know what they want. That's the bottom line for anything you buy. If you want a certain thing.
Let's look at two things: the language in your whether or not we kind of have a non-story because of that. And I think if then that language isn't in effect, I'm going to check with Cheryl and DJ to see what they say.
Because then they wouldn't be open until regular shopping was going to be whenever that is. We don't know what that is.
Okay.
But I haven't talked to any of my colleagues about this, and so I will ask them what their intentions were with their vape shops tomorrow.
Sounds good. Keep me posted.
Yeah. Oh, I will, because, after the board tells me what they're thinking, we have to decide what to do.
Okay.
Next week. We could do it easily next week if we want.
Excellent. All right. Well, thank you.
Can't hear you. Ray.
Ray?
Okay, now we go. Unmuted. Yeah, so Ron, I guess my question is both as a question to you and also just to inform you that we may have a sticky issue here that I'm sure we will not be the only community that will be facing.
That's right. That's right.
And again, it's not that we're trying to keep them from doing anything. We're just trying to get clarification on can those products actually be purchased from the curbside mode?
Yeah, I'm going to find that out.
Okay.
This has been discussed previously before this new phase in, and it's been an absolute no. But I'll see if there's any difference of opinion now that there's this new phase coming into play.
Yeah, because unfortunately, with everything that's been happening with this pandemic, there have been a lot of regulations dropped on the department that everyone's then scrambling, trying to figure out how the heck do we even enforce this? And it's not with a lot of clarity either. A lot of things are very coarsely written, subject to interpretation. Well, as always, Ron, I appreciate you taking an effort out of your busy schedule to come before us tonight. And hopefully the next time you'll be able to come before us in person in a live meeting.
I hope so. It's always a pleasure to meet. And I really appreciate the questions. And always, I feel a little, you try to be as informed as you can. But I have to say, your board, you can really challenge. And I mean that in a good way. It gets me thinking of things that
I always enjoy talking to you too, Ron.
All right.
Thank you for joining us tonight, Ron.
I'll be back in touch soon.
Thanks.
Okay. Now, seeing we have 3 callers, let's start off by doing an audible roll call. I'll start with myself. Chair Ray Barry is present. Maria?
Maria Zaroulis, clerk.
And do we have... Okay, so Bob Strano, you're on.
Tony Bichetti.
Okay, Dr. Bichetti. And then Charlie, you're on too?
I'm here.
Okay. Good. So we have all 5 members here.
Oh.
Okay. So we have definitely a quorum tonight. Okay, so moving on to the agenda. We have approval of minutes, and it's a lengthy list because not only do we have 2 monthly meeting minutes, but we also have minutes from our first 4 special meetings.
And of course, if some of them aren't ready, we can always push off, so you can vote on them separately, together, whatever, somebody maybe didn't get time to look at them. I understand that.
So Ray's gone through them and I've gone through them. And so what you have before you tonight are the minutes as Maria and I have reviewed them. So I guess I'll open as a general question for Mr. Scarano, Dr. Bichetti, and Mr. Rue is, have you folks had a chance to review those? And is it something that you would feel comfortable voting on to approve tonight?
Robert Serrano would have to abstain.
Okay. And Dr. Bichetti and Mr. Rue, what about you two?
I have a tremendous amount of confidence in yourself and Maria, Mr. Chairman.
I'm sorry, I couldn't get the first
I
part. There
have
was
it-
interference.
I'm comfortable if you and Maria have looked at them. I'm fine with them. I haven't had a chance to review them, but I'm very confident that if you've looked at them, they're fine.
Okay. And Dr. Bichetti?
I have reviewed them. I'm okay with it.
Okay. So hearing that, would someone like to make a motion to approve the minutes as submitted for all 6 minutes? Which would be the February 20th, 2020 monthly meeting, the April 16th, 2020 monthly meeting, and then the special meeting minutes for April 21st, April 28th, May 5th, and May 12th. So that whole collection of 6 meeting minutes. So if someone would like to make a motion to approve them as submitted,
I will make a motion to accept the minutes.
okay? And who'd like to second that motion? So Mr. Scarano's abstaining, so either Mr. Rue or Dr. Bichetti, one of you will need to second the motion.
I'll second it. I apologize. I'll second it.
Okay, so motion's been put forth and second to approve the minutes, all 6 meeting minutes as I've read off, approved as submitted, and we'll handle this by a verbal roll call. So, Ms. Cirulis, yay or nay?
Yay.
Okay. Mr. Rue,
Yay.
Dr. Bichetti?
Yay.
Okay, chair votes aye as well, and so motion carries 4-0 with Mr. Scarano abstaining. Okay. Moving on to new business. First item is consideration of extension for body art apprentice licenses due to inability to work during the pandemic. And the reason this is here, and you can fill in more, Susan, is that the apprentice permits are for a fixed duration, and as part of that, the apprentices need to work a certain amount of hours, and it's hard for them to hit that target hours if their facilities are closed due to the COVID pandemic. So we were looking to just extend the length of their permits by whatever the period becomes that the tattoo shops have been closed for, so they're not negatively impacted by something outside of their control.
So, Mr. Chairman, they're also not like on a specific date. They start when they get it approved, and then it's 6 months, and then 6 months after that. So one of them had, I think we only have 2 right now. One had renewed in February before this happened. So his is still fine, but it could be extended, that number, like you said. The other one is actually coming up right now. I haven't even reached out. I'm assuming that she still wants it. So whether it's extended a certain amount of time or we just don't charge them for this particular, but which I like that one though. I like the idea of just extending it the same amount of time. Does that work? Yeah. I hadn't
Yeah,
thought
that's
about
the
that
most
idea.
easiest way.
Yeah, hadn't thought about that, but that's a good way of doing it. But we just didn't want
I'm
them to
okay
pay
with it.
again.
I'm okay with extending it. Is it the oh goodness. How many hours is it they need for each of the extensions? Some of them may be working different hours. I'm not sure if they're all working full time.
Yeah, we don't know. And sometimes they come up and the trainer doesn't feel doesn't feel they're ready, so they ask for another 6 months. And sometimes they do it within the 6 months. It's really up to whether it's their full-time gig too. You're right. So
Correct. So I'm okay. I'm okay with that. Yeah.
good. It's $200 then, so it's a lot of money.
Yeah. No, understandable. I think
Yeah.
it's just extended whatever the time they've been out. I'm okay if the rest of my colleagues are okay with that.
I'm
Okay.
okay with that, and I would make a motion to that effect.
What? I didn't get it.
Want to try that?
Oh, jeez.
Any fee associated with this?
It's $200 for 6 months right now.
So, Mr. Scott, Mr. Rulis, any comment one way or the other in this item?
I think it's fine to extend it. I think that that's a fair thing to do. That's how I feel about it.
Okay.
Generally, I would ask someone to put the requested on, but we actually thought of this ourselves. So I haven't even informed them or reached out to them because they aren't working yet. So I don't know if this will happen with anything else. I expect the pools will open, soon, so theirs will be regular. There's not a lot that renews in the summer. So thank you.
Okay, so it seems like Mr. Scrum may have dropped off as a caller. But we still have a quorum on board. So I guess we will need a motion for this just to, I guess, Susan, allow you more of the administrative approval to extend the licenses, and I'll let you decide whether it's based on the length of duration the business has been out, or if something else is more suitable that would be just as fair and equitable. So if you want the administrative approval, just for us to approve extending it by the duration that their business has been closed for.
I'm back. That was the repeat of my motion.
I'm sorry, what was that? So who was just try again? So I'm not hearing you. We are definitely having audio challenges tonight. So Susan, would you
Brian, any ideas? This is rough.
it is real rough. Would you Yeah, it's tough when people are on a phone call because it's harder to mute when you're on the phone. So I don't know if you have the ability to do that or not. So I guess the question for Susan is, we're talking about extending the period, and would she prefer us giving her the administrative approval to make that determination of how long it should be extended by, or just to go by the period, the extension period to be the number of days that the business was closed for due to the pandemic, and just extend the duration of the permit by then if the permit has expired?
Oh, that's if I knew they were opening tomorrow, that would be easy. I'd just say 6 months from, when they come up, give them another 6 months. But
Right.
I think your idea probably is better. So when they reopen, maybe when they reopen, give them 6
Yeah.
months. I don't know. And just start them over again. Because like I said, it's going to be time anyway. It's already been how many months, they're not opening right now.
Right.
So I can just say, when you start up again, we'll just start them again and give them 6 months each. Just
Okay.
get them on the same thing. Give it a shot.
Okay.
Yeah. That would work for me. If that works for you guys, then simple.
I'm in agreement with what Susan says.
Okay.
It's fine. I want to be fair.
Okay.
It's a crazy.
So I guess then, Susan, the motion that you would suggest that we entertain would be just that once the business is allowed to reopen, that anyone that has the body art apprentice license, their 6-month period would start fresh with the opening of the reopening of the specific business that they're associated with then. Okay, so would someone like to make?
Sounds like a good idea.
Yeah. So would someone like to make a motion?
I'll make a motion to approve the 6-month extension of body art apprentice licenses beginning the date of reopen.
Okay. And someone like to second that motion? Okay, so Maria put the fourth motion. Who'd like to second?
I'll second it, Tony.
Okay. So motion's been put forth and second to extend the body art apprentice licenses by 6 months from the time that the business reopens. All those in favor signify by aye, and we'll do a verbal roll call vote. So, Mr. Rose?
Aye.
Aye.
Okay, so Dr. Bichetti, aye. Mr. Rue? Can't tell who's left. Okay. Yeah, looks like Mr. Scarano's not rejoined yet, so chair votes aye as well. So the motion carries unanimously for nothing. Okay. Next item is we have two, annual reappointment of health agents. We have Susan Sawyer as Director of Public Health and Shannon Sullivan as Sanitarian. These are just a formality, so someone would like to make a motion to approve the annual reappointment of both health agents. You can go ahead.
I will make a motion to approve the reappointment of Susan Sawyer as Director of Public Health and Shannon Sullivan as Sanitarian.
Okay, and who'd like to second that?
I'll second that unless Charlie wants to second it.
I think your second is good, then Charlie can second the next one.
Okay.
So the motion has been put forth and seconded to approve the annual reappointment of health agents for Susan Sawyer, Director of Public Health, and Shannon Sullivan as Sanitarian. All those in favor signify by stating aye. Again, I'll take a verbal roll call. So, Mr. Rulis?
Aye.
Dr. Bichetti?
Aye.
And Mr. Rue?
Aye.
Okay, chair votes aye as well, so that motion carries unanimously for nothing.
Yeah.
Next item is annual reappointment of special health agents. So there we have Irvi Agarwala for
And-
public health nurse, Ron Beauregard for tobacco control, Denise Graffio for town clerk for burial permits, Pamela Thomas, Tewksbury animal inspector / agent, Christine Gualtieri, Tewksbury animal inspector, Ashley Chamel, Tewksbury animal inspector, Casey Smith, Tewksbury animal inspector, and Maria Ruggiero, special agent. Susan, just a quick question. Casey Smith is a new name, so is that someone that joined the Billerica / Tewksbury Animal Control?
Yes.
Okay.
Yes, they have 3. I don't know if they're all full-time or if one, it used to be 2 and then a part-timer, but I don't know. It could be all full-time.
Okay.
But yes.
So if someone like to make a motion to approve the annual reappointment of those special health agents.
I will make a motion. Oh, Anthony can do
Oh,
it.
that's good.
You go ahead,
You can
Anthony.
do it. I'll second. I'll do that. That's okay, Maria. I'll second it. Go ahead.
Okay. I will make a motion to reappoint special health agents Irvi Agarwala as public health nurse, Ron Beauregard as tobacco control, Denise Graffio, town clerk for burial permits, Pamela Thomas, Tewksbury animal inspector agent, Christine Galtieri, Tewksbury animal inspector, Ashley Chamel, Tewksbury animal inspector, Casey Smith, Tewksbury animal inspector, and Maria Ruggiero as special agent.
Okay, and who?
Appointment.
Assuming Tony, that was you seconding it.
I apologize for the connection. I would second Ms. Garulla's appointment, Maria's appointment.
Okay, so you just second that motion, Tony, correct?
Yes, I'm
Okay.
sorry. I apologize.
No problem. So for the motion's been put forth and second to the annual reappointment of special health agents. So we'll take a vote, do a verbal roll call. So Mr. Rulis, yay or nay?
Yay.
Dr. Bichetti?
Yay.
Mr. Rue?
Yay.
Okay, and chair votes aye as well. So motion carries unanimously 4-0. Okay. So that concludes new business. Moving on to director reports. So Susan, I'll turn it over to you.
Believe it or not, there's a few things going on besides COVID. When I get a phone call and it's not about that, sometimes I'm happy to hear about it, but then I realize all the regular complaints and things are out there. And we have to, at some point soon, start getting back out and inspecting. A couple things came up when I was talking to Ray the other day, and one, of course, the Oliveira farm issue. As you know, it's not a public hearing anymore, but we've been asking Attorney Bornstein to keep us apprised of any updates. I did send you his latest. Sorry if you haven't had time to read it. I think he just gave it to me yesterday. I didn't ask him to come today. He would have made himself available, I'm sure, and he will next month if we want him to. There wasn't a whole lot new, and we hadn't received, if you remember, last time we received his plan maybe a day before our meeting, and it wasn't really enough time for anyone to review it. So we were thinking we might have some questions. And then, of course, we're all so busy. So if you do get a chance to look at his plan, and if you do have any questions for him or Mr. McCullough is the engineer, the consultant on the job, you can certainly send those to me and I can get them to him. And if you'd like him to come next time, I can do that. So, but I think he basically reported that there he hasn't, and Mr. McCullough hasn't gone out there because of course, what's going on right now. There's a lot less face-to-face going on. So there's still operating as it was before. And hopefully they're utilizing some of the things that were put in place as far as, properly following the animal through the process and reporting the way they're supposed to. I'm hopeful that they're doing that. And maybe I can ask them to send me a sample of what, how that's going. So that might be something that I could show you or pass on to you. Any questions about the Oliveira Farm issue?
May I ask one question, even though we had recused ourselves just from being a resident of the town?
Sure.
Why was there such a delay from them sending the paperwork in so you folks had less than a day to do that? This is my understanding as being a resident and as being aware of what was going on in the public hearing. I feel personally that there was some delays all along, so I'm deeply troubled that this situation, I believe, started sometime in October or November, and I think more than enough time has transpired. So being a resident of the town and trying to be observant of what our town is doing to maintain, the safety of the public, why did they ever give you any reason why they got it to you a day before? My understanding was these reports should have been in a lot earlier, and I'm a little disappointed that council just kind of, I don't want to say took a long time, but my understanding from what my observations were on the town meetings and the discussions on this were it should have been more timely, and I don't feel that it was. So was there some extenuating circumstances as to why the reports weren't given to you in a timely fashion? Because you have been very busy with a lot of things, and this has been going on for quite some time. And as I think everybody knows, I'm not a person that really likes to hear a lot of excuses from adults and professionals that are representing other people. So that's my personal opinion as a resident of the town of Tewksbury, and I just wanted a little clarification on this.
Well, Susan, I'll answer part of this, and I don't have the exact time frame, Tony, but my best recollection is that all our initial requests were done in advance of Mass DPH actually conducting inspections out there at the farm. And as a result of the DPH inspections and finding deficiencies, DPH had directed with a time frame that Mr. Oliveira was to respond to the deficiencies with written responses. And if I remember correctly, the due date for all that reporting back to DPH was sometime in mid-February. And then at that point, I told them that we wanted to make sure that the focus was they need to spend their time on getting the DPH questions answered, because that was under a sort of a regulatory deadline. And that once they were done that, then we'd assume that they would resume work on our submittal, which is what they did. I'm not exactly sure why that report was submitted as late as they did, but a lot of it was pushed back because they had to respond to DPH's inspection. So we did not want them potentially receiving a fine from DPH for failure to respond by the requested due date.
Okay, my recollection was that I felt that the DPH was somewhat delayed in their response, and considering the nature of the situation. So that's what that's fine, Ray. I appreciate the clarification, because I was in my observations as a resident of the community, I honestly thought that the DPH was a little bit lax in their timeliness, I would say, for lack of a better word. But that's fine. I just know our health agent Susan has been extremely burdened with everything going on, and I just know that there's been a lot of things she has had to take care of, and I just like to see people being reasonable when it comes time to do what's necessary to make our board be somewhat efficient and also what's in the best interest of the public. But thank you, Chairman. I appreciate it.
Okay. Well, thank you for the question.
That's all right. I appreciate that.
And just to follow up with you, yes, and I and others have expressed it at our Board of Health meeting since the November hearing for this issue, and that is that, yes, there have been some things that we've learned in this process about the state and who has oversight of what and the timeliness of things. So, yes, by no means was this fast-tracked by anyone. And,
exactly.
Unfortunately,
and
that's at the state level. That's not at the local level. It's
well, that's okay. That's all I need to know. Someone that deals with state functions on a basis. It's not what I would call a big surprise to me at this stage of the game. So
I didn't think so. I just
truly
wanted to put it out there.
Yeah, no, I thank you, Ray. It's not a surprise. We have a lot of lax, timely responses from things that happen with the state. So I'm totally aware of that. That makes much more sense to me. I'll tell you. So that's fine. And it's a disappointment because I know we all pay taxes, and I know that the state is they like to have their taxes done, but I also like to see our when we have services that we pay for, especially something of the nature that had happened in this particular case. It would have been nice had the state been a little bit more responsive for a situation that I think many of us felt were, as a resident, was somewhat grave, for lack of a better term, somewhat troubling.
Yes.
Yeah.
Well, I'd like to add
Go ahead, Susan.
I'd like to add that it definitely took phone calls to higher ups, and whoever made those phone calls, we had multiple people trying, who do you know? So we finally ended up getting a call from someone above. And it was it was an unusual time, but it was exactly at the time that we wanted the team, Oliveira team, to ask for an inspection. So they really got inspected because of our tenacity of keep going, but they thought they asked for an inspection on Friday and got one on Monday. But it really didn't happen that way.
And I appreciate
whoever helped. Thank you. Yeah.
And I, as a resident, appreciate all the hard work everyone did for this interesting type situation. And as I said, it doesn't surprise me the response of issues with the state. So, as I said, that doesn't surprise me. So, but thank you for all your hard work, Susan. I just don't like to see our agents that are working very hard be burdened unnecessarily due to delays from others. And that, as I said, it troubles me. But thank you very much. It's pretty clear now.
And Tony, additional piece too is that while this is going on, the zoning bylaw committee was also seeking input from town boards and residents on how to, what needs to be modified in terms of our local zoning ordinances and regulations. And I do not have it in front of me, but I did put forth to them on behalf of the board that they need to relook at the custom slaughterhouse zoning piece. So I think it's available on the town's website now, the zoning bylaw committee's proposed zoning regulations. I would just suggest you look at some point, just search through it for slaughterhouse and see what is now in there as a proposed changed verbiage.
Okay.
But there's verbiage in there based on us going through this.
Not wanting to do it again.
Yeah.
No, absolutely, absolutely. Thank you for the clarification, Tim. And then I understand it. I understand the situation, but thank you. That helps. As I said, just looking at it as a bystander and a resident of our community. Thank you.
Right, because our hands are primarily tied for everything. So even though it looked like it all belonged in us. So we have other direct report items besides that.
So that
had
we
a
have another,
restaurant.
we had another open item, which Jimbo's was in front of us a few months ago, and we made a number of requirements, or should I say, you made a number of requirements of them. Then COVID hit. They did hire the consultant. The consultant did go in and answer point by point each one of the inspector's list of items that needed to be addressed, and then was going to come up with the training program, which now that had been interrupted, as many things have been interrupted. And he did contact me, but this piece was submitted in a timely manner, based on the time that you would come up with. I forget, it was a week or 2 weeks, whatever it was back then. But he couldn't meet the other times, so we will be again reaching out to them when they are essential, and they are, they're doing well. We just can't have the consultant going in there and doing training right now. We did get some pictures, so I know they had done the cleaning immediately. If not before the meeting, they were already working on it. But they still have, last I heard, they were still going to need to do installation of a hand sink. So we'll make sure when that's going to happen. And I forget, they were going to do something with I forget, was the walk-in or a compressor, something like that. I'd have to reread the order, and then the training piece again. I can tell you I have not received any concerns or complaints during this time, and I know that people have been able to go in there and get their item and walk out. Initially, I'm not sure they do that now. They did close for a short period. I think when we all thought this was going to be 2 weeks, and then it was going to be 2 more weeks, I think they closed, and then when they realized it was going to continue, they did reopen. They did reopen for the takeout. So we're not ending this, and it will continue, because I know we want them to have a plan that they can follow, so they can look at this, daily, weekly, daily, weekly, monthly cleanings, and have training, ongoing training for whoever their new employees are, things like that. It just has to become second nature. So I think they heard you loud and clear, of course. So I don't anticipate they will not have this person on board to finish up soon, I hope. I will reach out to him.
That's great.
Any
Well,
question?
I appreciate that. Thank you. Yeah, good. Thank you.
And just a quick piece I'll add on to it, just for anyone that may watch this later and haven't caught up with prior meetings. When we have a restaurant that has had food safety code violations that warrant coming before the board, what typically has been our method of operation is to have that food establishment retain a food safety consultant who goes through, does an initial inspection, prepares sort of a list of what needs to be fixed first, then works with that establishment to get everyone trained, and then does follow-up inspections on a monthly basis, submitting those reports to the department for whatever period of time that we've set. And usually it's been based on having 3 good monthly inspections with no violations discovered by the consultant. So that has worked well in the past, and that's why we want to leverage that same process in this case as well. Okay, anything else, Susan, for ongoing items?
Just, yesterday you had Steve on your COVID-19 update, and he told you about us sending out the letter to all the businesses that we have emails to. So I hope you got that today. I don't know if you all got that. Shannon was going to send. Oh no, Lisa was going to forward it. Yeah.
We got it.
Okay, good.
Thank you.
So I don't know if it's that hasn't generated anything yet, but the calls are coming in from various industries, and I'm just pretty much sending them upstairs, and he's kind of vetting out. One interesting question came up today and I don't know the answer. I sent an inquiry to the state tell us about yard sales. What's going on with yard sales? Are they going to be allowed? If not this weekend, next week, or what's it going to be? So I don't know the answer to that. If anyone's asked you guys about that, but I will hopefully if I get an answer tomorrow, I will let you all know, because I know that's the kind of thing neighbors would want to know from their neighbors. So, and then of course I let the police know too. So there's no questions. So hopefully we'll get an answer tomorrow. So this will be a big weekend otherwise, I think.
And then Charlie, for your benefit, since you weren't able to join us on the call yesterday, Steve Sawick was on board, and Susan, please fill in any details that I may omit. But he was just getting everyone up to speed that he is the point person in the town for coordinating with all the relevant department heads, that as businesses are attempting to reopen, especially those that may have new requirements that they have to go through in order to reopen, specifically restaurants and I guess outdoor seating areas and the like, that may bring into zoning issues or other things that property owner may or may not be aware of. So Steve is trying to make sure the town works as proactively as possible, and while not doing the work for the applicant, to help walk them through and educate them what they may need to do in order to open based on the new regulations. So I just want you to be aware that the town is doing their best right now to help the business owners start to reopen, for those that are able to reopen. And Susan, please feel free to add anything else that I may have omitted from that.
I don't think you admitted anything that stands out, except so this is why tobacco just kind of shocked me today, in that since they haven't been asking, we haven't been thinking about that question. Had they asked, we'd already be in this loop, and so we definitely have to think about that. I don't know if the board, wants to consider, doing something next week, or if you don't think it's a good idea at all, I need to convey that to them as well. But this would be the kind of thing that, we have prohibitions or things, decisions that were made before, things that might need a one-time, short-term change or something. I don't know, waiver, what the words would be, or not. If it's a not, then I need to know that. So I just hadn't thought about it, to be honest. I thought they would be retail and forgot. I just figured it would be a logistical issue. I wasn't thinking about the regulation issue. And so it's good you brought that up.
Yeah, and the other piece, which I know you and I discussed, and we didn't get it on the agenda tonight, is that we did vote to have that emergency order for personal care services, and listed what types of services had to stop. And we never built in what the ending mechanism for that was, because at that point we really had no idea where things were headed and what the state would do. And part of this is we stepped in because the state hadn't done anything. And now where the state is sort of regulating, controlling what's going in, we just want to make sure that our regulation emergency order, we handle it or sunset it or terminate it, so that it's now the state going, because we don't want to be more restrictive than the state is in terms of allowing what is able to open. So I think I just need to work with town council on that, and then I think we still are scheduled, Susan, for our next COVID update on Wednesday.
If that worked for everyone, did that work? Okay.
Yes, I think one of the things I would put on the agenda for that Wednesday call then would be just revisiting that emergency order, and then we'll know what we need to do to properly end it now that the things are reopening. And then you had something good to report on COVID.
I did.
The donation for what's going to be offered for seniors.
Oh boy. I'll tell you, a couple hours and you forget things. So there was discussion. I guess MEMA has received quite a few masks. They're cloth masks, washable, reusable masks, and they're sending them out to the towns. So we had discussion with Chief Photo and Chief Hazel and Irvy and Senior Center. And so what we're thinking, it's not enough for the whole town, but of course we want to first make sure our vulnerable and over 60, 60, 65, 60 crowd has them if they need them. So there will be, I guess there's a big list from the Senior Center. I think they have a contact list that's quite large. I mean, thousands of people. And so that will be going out in an email saying you can ask by email. And generally we'd probably give 2, but if they have many people in their family, they could ask for more. And the police department will actually has offered to deliver these to the citizens that ask. We have gotten some requests. It's not, they don't flood us with requests. People do call and say, why aren't you giving them out? Because so-and-so did it in another town or something. We just didn't have enough for everyone, but we'll have, over 1,000 or more, hopefully. And who knows? One thing I learned today too is that apparently the quilting club at the Senior Center is going full board on making masks, and I know they have about 150 available over there, for the staff and for any seniors who are looking for them too. So we have different kinds. The cloth ones we get. So I'm not sure which ones they get first, but it might be the pink ones that I have, on each of those, or the cloth ones. Depends which ones we send out first. But it'll be interesting to see what kind of reaction. It's not just going to go to them, it's going to go out to the general pop too. But we do want to make sure that the seniors first on this. And then hopefully if we get more, we'll do it again. But we're going to see what the reaction is. Rather than have a big drive-through, train of people and things like that, who can get there first. And we're going to try this. And we'll see what kind of reaction we get. And we can go from there.
Just update, any resident that has signed up on the town website to get emails of news postings and announcements would have gotten an email that was sent out.
Was it sent out
at 4:30, 4:27?
There you go.
The availability of masks. So
Okay.
That message has gone out for those that.
Was I right in how I worded it?
Yep. Yep.
Okay. Yeah.
And then there was another notice that went out today that since there are things that we deal with other than COVID of.
Oh, yes. Yeah. So
it's
mosquito time starting. So we've posted the dates that the Central Mosquito Control District would be able to come to town if you are interested in having your yard treated. And that's who you contact them through their email, or you could call, but they have it right on not their email, but on their website. You can put in for requests for them to come. And then they come on those certain dates they'll be in town. They're not going to be in town on those dates to spray the town. They're answering, requests, and they're probably doing some hotspots that, places they normally do. but it's not like there's no blanket, spraying on those days. Some people think that's what it means when it says they're in town. But in this community, you have the opportunity to ask for it. Not all communities do that with their management plan, but this community does. So, as you know, it's not something that lasts forever. So it's basically contact, so it's not something that lasts all summer, but it's on contact with the actual mosquitoes. So, it doesn't last. I don't want people to think it lasts all summer, but it does knock down, a population. We had quite the time with Triple E last year, and I haven't read any scientific thought, but new scientific evidence about this. But the previous thought was when you have like Triple E in your area, it generally takes about 3 years for it to kind of go through its cycle. So it's anticipated, at least, predicted that it will be another year that Triple E is going to be here. We're going to have to deal with that as well.
So on that, Susan, at some point when there's a free moment, would you be able to, unless you've already been notified by the state of what their plans are and for when they would start testing for Triple E and other similar insect-borne diseases?
Yeah, they do tell us when they start doing the trapping. I'm also aware, I heard there was a bill in the legislature now that has something to do with one of our concerns is not everyone is in the collaboratives, these Middlesex or Essex County. Then we have cities and towns that are not in them, and it does cause some problem. So I don't know the ins and outs of the bill, but maybe if we can get some of these communities that, brought in together. I don't know if it's going to go anywhere, but if it does, I'll let you know what the changes are. But right now, you have to opt in, and we are in. But yeah, they don't usually start testing for a little while. And as we know, generally the diseases don't show up till later in the summer, but don't quote me on that because Triple E is another animal than West Nile because they love different things, different types of swampy areas, things like that. So I don't know, but I will let you know.
Okay, thank you. So anything else, folks?
No, I'm sure there's plenty, but no, not at the moment.
Okay. Marie, anything on Tewksbury Cares?
Well, Tewksbury Cares has been on hiatus, like many other groups right now. We did have a fundraiser that was planned for the end of April that unfortunately had to be canceled, and we can't reschedule it until we know more when that would be safe. I was on a call earlier this week with Maria Ruggiero and members of the Greater Lowell Health Alliance, a Board of Health member from Chelmsford, and some other groups. More just to talk about some of the challenges that all of our communities are facing regarding COVID. It seems like the biggest issues are around mental health with the youth and with, the older population. The other issue is substance abuse is on the rise, as well as those that were in recovery are relapsing during this time. So sort of brainstorming about different programs or what can we do for outreach to get it out to the public. What resources are available to help these people, since for the most part everyone's home. They're not getting to an AA meeting on a regular basis, or maybe a Narcotics Anonymous meeting, whatever it is. So that was what we talked about. And I found it tremendously helpful to talk to people from surrounding towns about what they're doing. One was a school resource officer in Tingsboro. So she's trying to find ways to reach the kids during this time. She's been using different social media apps that kids are using, like TikTok, even Snapchat, to kind of get messages out to them, because that's what they're doing, that's what they're looking at. So I found that pretty interesting as well. We don't have any Tewksbury Cares meetings scheduled right now. We are going to try to set up a virtual meeting in the near future. And when we do, we will announce it and we'll invite everyone on our list. But for now, that's where we're at.
Okay. And anything from any other board member?
No, thank you.
Okay. So we will have maybe our last special meeting next Wednesday, and we'll just see how things are going. And then our next monthly scheduled board meeting is Thursday, June 18th at 6 p.m. And at some point we'll be able to go back in the town hall. So I don't know if the June one will be another virtual meeting or if that will be a in-person one again. So I guess, Mr. Rue, it's your time right now.
Mr. Chairman, before I make my motion, I'd like to thank Susan and her staff. I mean, I know what they're going through down there, believe me, and some of the phone calls are on a good day challenging just to answer some of the things that she's been putting up with. So I thank you, Susan, and your staff. In the meantime,
Thank you, Charlie.
I'd like to make, you're welcome.
I would
and
like to
thank you.
reiterate that on Charlie, too. Thank you, Susan. I know how hard you work in there and the staff.
It's really tough right now, even putting up with some of the, some of the commentary that's been coming across my phone regarding this stuff is rough. But anyway, Mr. Chairman, I'd like to make a motion to adjourn tonight's meeting.
Okay, and who'd like to second that motion?
I will second that, but I would like to say one thing just before I second it for the end of the meeting.
Sure.
I appreciate everything. I appreciate everything Susan and the staff is doing, and I hope for the community as we all get back to somewhat of a semblance of a new normality. I would hope that everyone within the community still, this is our home, this is our town, residents, employees, and everything. I would hope we would all work together and be reasonable and understanding of everything that's going on. My experience has been that some people, in spite of this situation, I'm not always sure they're as reasonable with everyone that they deal with. So I'd just like to, wish the community good luck and success with everything, and hope that this situation is quickly resolved and we're back to a semblance of normal. But on that, I would like to second Mr. Rue's motion, and thank you, Susan, again, and the rest of the community working together. So I appreciate it. Thank you.
Okay, so motion's been put forth and second to adjourn tonight's meeting. We'll take a verbal roll call. So yay or nay, Ms. Arulis?
Yay.
Dr. Bichetti?
Yay.
Mr. Rue?
Yay.
And I guess the chair will vote aye as well. So motion is unanimous. So it is 7:23 p.m. Good night, Tewksbury.
Good night.